Welcome, friends, and thank you for tuning in to the Optimal Health program today. Hope you're all doing well. As we chat each week, or a few times a week, about different things, I think of bringing forth interesting information that will impart, greatly on people in the population and society. And today, we're going to talk about a few things. Talk about vitamin deficiency. Once again, we're going to pick an individual vitamin on each program and talk about the importance and necessity of them. Today, we're also going to talk about brain function and how we can do testing to look at the speed of your brain and calculate whether or not your brain is aging faster than it should, determine whether we need to take some interventional steps to improve memory, focus, concentration, word retrieval, alertness, all of these things, because everybody wants to have a better brain as they get older. Everything shrinks as you get older, which is unfortunate, but that's a fact, including your brain. So we don't want your brain to shrink. So we can cover a variety of different topics specific to that. As well, remember, we're going to take your calls here, lots of calls, at 1-888-420-9272, 1-888-420-9272. And we'll get your calls and your texts and your emails from our tubers. What do we call Redditors? Our Reds, tubers, Reds, grammars, and talkers. The entire group of our lovely, faithful followers.
We had a bit of a fight with Reddit, but we're back.
Okay.
We're back.
Sounds good. It's all getting the mechanism working well. That's what we're trying to do, to make things work as easily as possible. And thank you so much for emailing the office through the website and asking your questions. We'll go through a bunch of those today. So let the information begin. Let's talk a little bit about the vitamin A. So vitamin A is critically important for your body. And as I've mentioned, as I do with every vitamin, we test all of your vitamins, minerals, hormones, cover the gamut, heavy metals, as you know. But correcting vitamins makes a very important case, because for young people that don't have enough vitamins, their brain development's not going to be as good. Even immune response, bone development, as we get older, we need more and more nutrients. The more active we are in our teens and 20s, then we're using up vitamins faster. We need to check those levels and keep them up. And as we get older, we want them to be there for every part of our body, our heart, lungs, liver, kidney, pancreas, immune response, etc. So this is a great study that American Journal of Epidemiology talks about serum vitamin levels and the risk of asthma in children. So they're looking at vitamins A, C, E, and the carotenoids, and deficiency in these children, 4,093 children in this study, showed significant correlations with asthma. I can also say that in people that don't have enough magnesium or potassium, the smooth muscle around your airways, getting into your lungs, might be tighter, and that tightness makes it harder to get the air in to breathe and to get it to your lungs and to be able to do activities. So for some people, low magnesium, potassium may play a similar role. Vitamin A is also really important for your immune response, and it has pretty good anti-inflammatory characteristics. In research going back to 1928, they saw that, and they called vitamin D the anti-inflammatory vitamin. They saw that it decreased the inflammatory cascade. Very interesting. Also, it's important for formation of epithelial and mucous tissues, your mouth, your organs, things inside your body. Epithelium are the lining of your tissues. Other organs like thymus, which is the starter of your immune response, is dependent upon vitamin A. B and T cell mediation, antibody response, macrophages, neutrophils, all of these things correlate with vitamin A. So important to test for all your vitamins, and including, especially vitamin A. Let's talk about brain function. So as we age, every cell of your body needs vitamins, minerals, and hormones, oxygen, to work well. Over time, if there's less blood flow delivering those nutrients and the oxygen, your body's not going to, the cells are not going to do well. As well, when you're 15 or 18 or 20 and you're making trillions of cells every second, repairing and replacing, you think you're invincible. Your body can do all sorts of things and do it again the next day. You're fine, because that level of repair is gigantic. As you get older and that level of repair keeps dropping down, you're not making the trillions of cells. And the loss of cells is what we call aging. So any doctor or person who's ever seen a CAT scan or MRI of the brain, when doctors look at young versus old, and we all have relatives that have had these tests done, you can see, and they'll talk about shrinkage of the brain. So the organ itself starts to decrease in size. That's because you're not making the new cells. As well, neurotransmitters, the chemicals that make your brain work, going from neuron to neuron, and the rapid speed of electrical function in your brain decreases because of that. You have less cells, you're making less neurotransmitters. So there are outside things that can damage your brain. Heavy metals, we've spoken about that. Lead, mercury, cadmium, nickel, arsenic, aluminum, all of these things. And aluminum is especially correlated with Alzheimer's disease. So metals damage function. Elevation of homocysteine, which occurs when you don't have enough B vitamins, B6, B12, folate, and methyl B12. Homocysteine can cause inflammation in the blood vessels. That also creates degeneration of brain tissue. So there are a lot of different things that we could talk about that create the change. So hormone decline as well. There is one unique test, and it is the best of all the tests for brain function, and it's called a brain scan, loosely called a brain scan. Evoke Neurosciences has made something called an EVOX, which is a machine where you wear a cap, and this cap fits snug on your head. You come into the office. You don't want anything in your hair. You want to have it nice and clear and clean. And then we use a little bit of a gel in about 20 different openings in this cap. And then we plug 20 different wires coming off the cap that go to a computer to read the electrical activity of your brain. And yes, it's an EEG, electroencephalogram, but it's way beyond the basic encephalogram because the database that they have, where they're looking at your brain and comparing it to many, many thousands of other brain speeds and brain function with individuals that have a completely young and normal brain. So you can compare against that to see the deviation against that perfect norm. Or you can compare to those that have ADD, depression, anxiety, people that have dementia and loss of brain function, decrease in cognitive function, decrease in word retrieval, all of these things. You can see where your scan, fits within that realm. And of course, they take into consideration your physical and your functional ability. If we use a mini mental status exam and we ask someone to remember 3 or 4 different words or items that are completely unconnected, and then within a minute, I'll ask them to repeat those words, and in 3 minutes, ask them in 5 minutes. The people who can't remember the words obviously have a significant defect, but this also would show up on this brain scan. So they've done a wonderful job in making a device that has a perfect way to look at multiple tests and functions of the brain. So here are a couple of pages of the actual report that we get, where we're looking at cardiac waveform, heart rate variability, because it's looking at that to make sure they show within good range. If you go to the next couple of slides, you can see memory, attention, word fluency, affect, sensory, motor. So we're looking at speed and determining where there's decrease in function or ability. Again, heart rate variability. If your heart rate's changing a lot, then that's going to have effect on your brain as well. And there should be a chart that's a P300, spatial navigation, temporal orientation, procedural actions, episodic memory, face recognition. So a lot of different parameters are seen, and this gives us a great idea as to whether your brain is slowing down or not. So very important test to do. We like to do this test early on, and anybody who says they've had some change in each of these areas, memory, focus, concentration, word retrieval, you walk into the room, you forget what you're there for, you forget where you put your pen, your glasses are on your head and you can't find your glasses, any of these things where you start to see some changes. If it persists, then you want to see why that's happening. Again, based upon that, and looking at this report, once we evaluate it, we can start looking for things that are causing that problem. So again, this is the perfect and the most significant and sensitive test of your brain to see what's occurring. If we feel that heavy metals are playing a role, and then we decrease the heavy metal burden, and we start to see these things improve, you could repeat the test down the road and prove benefit. When we do stem cell therapy for patients that have brain-related changes, Alzheimer's, Parkinson's, MS, stroke, etc., You can see people that have the defects, and after doing the procedure, the stem, we're watching to see them functionally improve. They could walk, they could talk, they could answer questions rapidly, and you're seeing all this in a functional mechanism, but this could be repeated as well to prove, yeah, you were really slow there, and now your brain is super fast. So it's a great tool to use in a variety of different ways. For some people, we'll add on, and probably most people will add on NAD, nicotine adenine dinucleotide. Those are little injections that we do for patients that it helps brain function, focus, concentration, memory, mood. We may correct hormones in some of the individuals, and that can create result or benefit. So it depends upon how you present and what your body's going through. Not everybody presents in the exact same way. So people will come in with a variety of different, levels of dysfunction. And again, whatever we see, we want to try to improve by the comprehensive blood test, the comprehensive medical nutrition approach, over 200 different things we look at in your blood, and fix each of these things, and then watch and document the improvement. Phone lines are open, 1-888-420-9272, 888-420-9272. If you'd like to call in and ask a question, you could do so now. Anybody there?
Already got one.
Great.
Not a caller, but we have a question on Instagram. What are the negative side effects on stem cell therapy using your own cells?
There are no negative effects using your own cells because they're your own cells. So we take them from your body, it takes a minute and a half to extract, spin them for a half hour, and we put them back in your joint, intravenous or intravenous and nebulizer for lung or intravenous and nasal for brain. Those cells have the same language as the rest of your cells. So it's just taking them in a larger amount and putting them in so they can go to areas of damage and degeneration and become new cells of that damaged area and make repair. That's what they're meant to do. That's their only job. And the other job they have is to shut down the inflammatory mechanism. We'll talk about that in a few minutes as we discuss rheumatoid arthritis. So that may not be true for other person's stem cells because it's a whole different language. And your body typically will reject things that are foreign, and you don't know where you're getting foreign tissue from. You don't know the genetics of that donor, the infectious history. You don't know how the cells are kept. How old is the frozen cord? You just don't know any of this. That's why they don't allow it in this country. That's why people have tended to go to other countries to do that sort of thing. So your own cells are the ideal. It's the perfect recommendation. It's probably the greatest discovery in science because the applications are vast to help to repair your body.
And then YouTube, we have, can you get stem cell therapy for exocrine pancreatic insufficiency? And then long COVID, question mark.
Yeah, so for pancreatic issues, and we use it for pancreatic decline. We use it for liver, kidney, heart failure. So we use it for diabetes all the time. So we know that when you do an IV with the stem cells, it will get to the areas of damage and degeneration, set up shop, and become brand new cells. They turn into cells of that damaged tissue. That's their reason to exist. So typically we see the diabetic patients that are on meds and some on injectables and insulin, 2 to 4 or 5 months, you can start to see that they may not require their meds anymore. We've seen people that have become non-diabetic in 2 to 4 or 5 months. And there are a couple of great videos on the website that describe that. So, but remember, it's not just here, do stem and, go on your way. We sit down with you, take your history, your blood work. We go over your blood work, get you on a low-carb diet to keep the sugars down that are coming in, get you to do exercise a half hour to 45 minutes a day of something that delivers great oxygen flow, vitamins, minerals, and hormones as we correct them to your cells and your tissues. So correcting each of these areas and doing the stem is the comprehensive way to fix that mechanism because there's no other thing that we forget to correct. So it's covering every part of the problem, covering every base of the problem, just not putting you on meds to keep the problem there. The whole idea is to change the cause. So that would be the thing that would give you the most comprehensive benefit. And the second part of the question was?
And then long COVID. Where's the follow-up?
COVID or the injectable are things that cause inflammation in your body. And everyone's seen or heard of bad side effects. And that inflammatory cascade is something that COVID stem cells respond to. We've had patients that had lung issues before COVID, got COVID, lungs got worse, And whether they had allergy or not, some of our patients have, and we also address that. We'll talk about that in a minute. But those individuals that had long COVID or have long COVID, as we understand the picture, we correct their vitamins, their hormones. We might do some vitamin C IVs because vitamin C IVs has been shown to inhibit viruses, including COVID, Epstein-Barr, shingles, herpes viruses. So that's been documented by traditional literature. Doing STEM helps to put brand new cells in to create repair of damaged lungs or damaged liver, kidney, heart, etc. So you're replacing old degeneration and inflammation with brand new cells. So that's why it's such a great mechanism. Also, if you're vitamin deficient, we'll correct your vitamins. I just mentioned that vitamin A is very important for your immune response. So is vitamin C, zinc, D, all of these things. So we're covering each of these areas to correct all of them. For those people that have allergy, that may be a cause of their breathing issue. And prior to COVID, if we look at the allergy mechanism and take the food allergens away or treat the inhalant or environmental allergy, that decreases that component of inflammation. So there is added benefit for doing that. So, you can present with a variety of different things. The common sense is to learn everything we can about your body, then put together combinations of therapy that works on each of those different areas. Of course, doing the STEM is a much greater repair for damaged tissue in any part of your body, and as well shuts down the inflammatory cascade. So that is the comprehensive way to look at that picture.
The caller.
Okay, let's get our first call in.
How are you?
Good. How are you doing today?
How you doing, doctor?
Great.
I'm good. My name is Tom. I'm 52 years old. I wanna touch on it's an overused term, but brain fog, things of that nature, and what can really be done about it. Like really more focused than anything else. Like things that were like no problem tasks. I find my brain like wandering out during the course of the day.
So over time, as I mentioned before, as we get a little bit older, we're losing cell, renewal or replacement. So that decreases some of our neurotransmitter, production. Also, if you look at everybody and all the patients I've seen in the better part of 38 years, most people are deficient in vitamins. In some people, just correcting vitamins and their brain function starts to improve. In some people using methyl B12, where they may or may not convert B12, giving a methyl B12 shot can improve brain function and help with cognitive function or brain fog. Some people have allergy that plays a role with brain fog, and they don't understand it. They don't realize it. They may not have a symptom when they eat the food for that moment, but they may eat something, but it takes a couple of days or a week to create some sort of response, an allergic response, an inflammatory mechanism that makes them feel foggy and out of it. Hormone decline, thyroid, DHEA, testosterone, IGF-1, which are all important to create good function in every organ, every part of your body. That will help to add to the picture. Heavy metal exposure will do that absolutely. And we know that aluminum is linked with dementia and Alzheimer's. So there are probably at least a couple of dozen different things that can correlate with brain fog. That's why I have this discussion with every person who comes in. And honestly, whether they have brain fog or not, we're talking about the same things. Do you take vitamins? What are you eating? What are your vitamin levels? Did you ever do blood tests for vitamins? Most people haven't. Do you have any history of allergy to things you breathe? Because the people who have inhalant allergy also typically will have some sort of food allergy. It may be delayed, but these are all important parts of the whole picture. So I would look at all that, the entire mechanism,
Just to touch on a couple of things you have said. I am currently on TRT. My thyroid is good, and I've done some vitamin work. But lately, what I just did one of those DNA scans, like when they do your DNA and all that kind of stuff. And I did a very thorough one, like a very comprehensive one, that they tell me how my particular DNA deals with different vitamin deficiencies, and if I get enough. I don't know. I mean, this is what I'm reading from something that I did. Maybe you could touch on it. Like, it did say that my genes have a very difficult time methylating vitamin B and zinc as well.
Yeah.
From food.
That's important because the two usual sources of B12, hydroxycobalamin or cyanocobalamin, need to be converted into methyl cobalamin, methyl. There's a gene in your body that allows that conversion. A lot of people have that. But then again, we see more and more people, because we've been testing for it for the past decade or more, that don't have that gene. So if we do that test and it shows you're missing the gene C677T, which will help take those two forms of B12 to make them into methyl B12, you're not getting any function, any benefit of B12. Your homocysteine would tend to be higher. That can cause plaque in your blood vessels. That could affect your brain function. So, and vitamin B12 is important for brain function. Also important to decrease anemia, because people have B12 deficiency anemia, just like you could have iron deficiency anemia. So those people typically will recommend, we'll give them a B12 shot in the office once we see that they're not converting. And we ask them how they feel over the course of a few days from doing that. But we'll typically teach them how to give themselves the B12 shot with methyl B12. That's the only type we use. And you use a tiny little, like an insulin syringe, and you just go into your skin subcutaneously, and you can do that a couple of times a week. And then all of a sudden, you've got your B12, you got your energy back, your brain functions better. So that may not be the only thing you need to correct, but that's really common. I think the genetic tests, years ago, when some of these tests first came out, all the labs were doing it. And every patient wanted to do it. Every doctor wanted to do it. And they were broken into two different categories. One was called the PGX and one was called the PGC, I think. The PGX was a genetic test to see how you metabolize medications. And they looked at all different categories of medications: blood pressure pills, antiarrhythmic medications, psychiatric medications. And when you take medication, your body tends to break that down into an active metabolite, and then it's supposed to work. But sometimes your cytochrome P450 system, for example, through your liver, doesn't handle certain meds. So there seem to be three categories of your body's response. Either it has no effect on that medication and it'll never help you, or that medication can build up and cause you side effects and you should never take it, or you might get some result from it, but it may not give you a thorough result. And here's a list of medications you can't take with that medication. So I thought those tests were brilliant. We ordered them for lots of patients who were taking multiple meds. Right. The other test was the PGC test, was a cancer test. So if anybody in your family had cancer, you want to see if you have a genetic risk for breast, colon, lung, prostate, any of these things. Another test, genius. And it was able to show that, if you have a relative that had prostate cancer and you're a male and 5 people in your lineage had it, then you've got to look for that and constantly watch your PSA, free percent PSA, screen for these things, do sonograms, and just be on top of the picture. So God forbid something happens, you catch it early and it's not a big problem. But the labs doing these tests were charging a huge amount of money. And then the insurance companies didn't want to pay $5,000 to $7,000 or more for those tests, and they stopped it. It was a great test. Could they have made it for a lesser expense? I imagine so, and I don't know why they wouldn't, because everybody wants to do those tests. So I think genetic testing is a great idea. It's just a matter of cost, and the insurance companies don't want to pay. They want to pay for something that could really help and save you.
They'd rather pay when you're sick, I guess, so they can give all their pills and drugs to you.
Think of how crazy that is. They pay for therapy for different things that they might be able to prevent. So let's say a person's on 2 heart medications, blood pressure pills, pills for arrhythmia, irregular heartbeat, on medications for their gut, for their brain, whatever else, and these meds don't interact well with each other, or one med knocks out the benefit of the other, and the doctor's pushing another med because he doesn't see the response he wants. That's dangerous. That could be prevented by that test. That's why I thought it was such a great test, and I loved it.
And like what you do as well, stem cells, I'm sure they give a very hard time about that.
They always have, because it flies in the face of, what traditional approach. Because it works, it flies in the face of traditional approach. So, no surgeon wants to give up a big surgery on a knee, a shoulder, a hip, for a stem
insanity.
cell.
I mean, look at the hospitals charge for the surgery, for the anesthesia, for the surgery, for everything. As compared to, trying an alternative, it's not even alternative medicine really with stem cells.
They're not alternative at all.
I mean,
it's a standard. It's used for cancer. It's a bone marrow transplant. So that's an accepted mechanism. And STEM, the research goes back about 100 years, where Dr. Haeckel, who was German, by the way, found out that and saw those cells, morphing, differentiating into every other cell in your body. So it's the beauty of that. It's the greatest idea. I think it's the greatest discovery in medicine. But, you know, as you can tell over the past few years, and people understand what I'm saying, as what's going on, you know, with forcing people to do things they may not want to do, non-disclosure, they're not disclosing all the risk of some of these things. You know, you have to be alert and aware. And you have to figure out what you want to do and you don't want to do.
So one thing you had said before when we were discussing different vitamins and whatnot, the how the body methylates homocysteine. You said that could lead to plaque in the arteries.
Correct.
Could it also lead to like hypertension?
Well, there's a variety of things that we see happen for those people that have the low uptake or the non-conversion, the B12, have the homocysteine up, their vitamins are low. Hypertension can come from vitamin deficiency. So one of the easiest or simplest forms of hypertension is you don't have enough magnesium or potassium to keep the tone of your blood vessels open to allow good blood flow. So typically the people that have high homocysteine also have other issues because they're not taking their vitamins, they haven't tested their vitamins, maybe they're not eating right or exercising, and their minerals might also be low. So, you know, it comes along with a whole bunch of different problems.
Okay, well, one other thing that the test had revealed to me, I've had a very difficult time losing weight, and I don't know if you're familiar with it, but there's a gene called RS9939609, and according to the test, it creates insulin resistance and you know, things of that nature. But there was a time when I wore a what do you call those things? The diabetic sensors, you know, on your arm to see your blood sugar.
Yeah.
And I never really had like, you know, huge spikes. I'm not like, you know, I never had like huge sugar spikes, but the reading I did on this was that it creates more, like insulin's always flowing, so the body's used to it, and like so that doesn't allow the vitamins to get into the cells. Like, is that how it works? I'm confused.
Well, with insulin resistance, you're releasing insulin, but your body's resistant to it, and it's not working. It's not getting the job done. So typically your sugars would tend to be higher because even though the insulin's there, it's not taking the sugar, putting it inside your cells. So those individuals typically have more weight on board. You know, for people that are insulin resistant, we really have to cut the carbs, got to beautifully correct the hormones, thyroid, DHEA, testosterone, IGF-1, because when IGF-1 is low, you're losing the ability to burn sugars and burn fat, and that's a great reparative hormone as well. Kick up the exercise. So I think of it as sort of a little machine with dials. Lower the carbs, raise up the exercise, raise up thyroid, DHEA, testosterone, IGF-1. And there are some people who do well when you add the weekly injectable on to just decrease appetite and help to metabolize the sugar better or faster. Right. Some people do a little better with metformin. So whatever added benefit we can give them if we do a medication for a short period of time, I think can make sense until we get a handle and start to see the result.
I mean, are you a proponent of the these shots that everybody's taking like forever, or
no?
No.
And I tell them right off the bat,
just a matter of a corrective procedure, and then maybe backing down your diet and getting on. I
tell them right off the bat,
program.
if you're going to do this, you have to do the low carb, the exercise, 30 to 45 minutes every day, nonstop. You have to correct whatever hormone decline you may have, vitamin correction, mineral correction, etc. Because if you just do the shot, and we're not going to do that for them. They just want to do the shot and nothing else. We wouldn't, treat them. You have to do it all together because that way you get your best result. And I don't want people on these meds for years and years because there are side effects to the meds. They can affect your pancreatic enzymes. Had a discussion with the patient the other day where he was using it and he lost a little bit of weight. And I don't think he was following the plan because it was only a little bit of weight. But then when we checked his pancreatic enzymes, they were elevated. So I told him he had to stop. He didn't want to hear that. I said, you have to stop. Your pancreas is being irritated. But you've got to do the whole thing, the diet, the exercise, because that's where you get your fastest and your best results. And then people will say, well, if I'm off the shot, am I going to gain it all back? No, because you're already doing low carb, the exercise, and we've corrected your hormones. So the things that led you to that place where you gained the weight and lost your great ability, appearance, and function, et cetera, is now changed. We just use that as a little bit of a crutch to get the machine running, get the freight train running down the track.
Right.
So.
Okay.
Great.
Thank you very much, as usual, and I will see you hopefully soon, Doc.
Thank you so much for your call. Great talking to you. Great
Thank you.
questions.
Bye-bye.
All righty, phone lines are open. We're here to take your call, 888-420-9272. And getting some great calls once again.
Oh, yeah. We got a good question on Instagram. She says, I have been dealing with post-concussion syndrome. Or post-concussion syndrome. The car accident that resulted in the concussion was January 9th, 2023. I've went to physical therapy, vestibular therapy, and eye therapy for a year. Any suggestions?
So, yeah, when we're dealing with a problem, we have to think about the cause. It's not, as I say many times, it's not appropriate just to try to find something to change the symptom. Could be any number of pills or medications or therapies to change a symptom. You want to correct the cause. So in this circumstance, when you get hit and your brain is rattled a little bit inside your skull and you're hitting brain cells and damaging some of those brain cells with that, what they call coup and contra coup, concussion, the best mechanism to revert any brain-related degeneration or insult, even full-blown traumatic brain injury, as you can see on the videos on my website and here on the podcast, is stem cell therapy, because we're using your own cells from your body and putting them intravenously to get to all your organs, and a nasal approach, drip it into your nose while you're laying down on the exam table, and as that drips into the back of your nasal cavity, it goes to your brain, you're making brand new brain cells. So just for the moment, think of stroke. It's worse than a concussion. Traumatic brain injury, a gentleman blown up in a vehicle in Afghanistan, and we have a bunch of those. Horrible cluster headaches, where even we interviewed a gentleman who had electrodes put into his brain to try to rewire or do something that didn't work, and they've had spectacular result with stem cell therapy. So if you put brand new cells in where your brain cells were damaged, those new cells, those stem cells become brain cells, and that's what creates the repair and the improvement. But yeah, take a look at the videos on the website. We have a few of them. The gentleman that we treated, who is a veteran, I think he's about 6 or 7 years out and hasn't had any headaches, significant brain dysfunction. And when I first met him, he could barely function. He couldn't work. He really couldn't do anything. He was bounced around from one VA to the next, and they tried all sorts of things and nothing worked. He graduated law school, I think, last year. And he's as fit and as strong and as functional as anybody I've ever seen. So he's 100% back. Maybe more, because he's so excited about it. He's working out more. And we're trying to get, the armed forces to understand that this should be done for anybody that's got the traumatic brain injury or any injuries for veterans as well. So, yeah, look at the videos. You'll be pretty amazed to see that.
We have another one from Instagram asking, are mammograms harmful?
There's some thought that there may be, because it's squeezing, painfully squeezing the breast and, using radiation X-ray on the breast tissue. As much as traditional doctors may not agree to that. There's an interesting story, 2 interesting stories I'll tell about that. So mammography and thermography in a big study were done side by side. Thermography, nothing touches you, it just takes a temperature picture of breast tissue. And where there's a hot spot on this infrared temperature picture of breast, that could be cancer trying to get more blood vessels to it to feed it more blood flow and therefore more glucose or sugar to make the cancer grow faster. And they've proven that with mammography and thermography side by side over 10 years and going beyond in a study, thermography was able to pick up abnormalities before mammography, so it makes it a better test. It's more sensitive, more specific, no risk, no side effect whatsoever. So for all of my patients in the past 10 years, we've been talking about going for thermography for breast tissue. And there are lots of different doctors that do that all over the country. One of my favorite doctors to do that, and we're going to interview him one of these days, is Dr. Deckel, Dr. Moshe Deckel. He's between here and I think in the Carolinas. He goes back and forth. But I think that's a better test. It's more accurate based upon that study, so it's a better test for you to do to look at those tissues.
Got this one. Can you order vitamin A and use it in IV form?
Vitamin A, I don't think it's available in IV form. it's a fat-soluble vitamin, just like D is not available in IV form, nor E. So the vitamins we typically use are vitamin C, the Bs, etc., minerals we put into the vitamin IV. So it's a combination of things that the manufacturers create for that purpose. CoQ10 could come in IV form, but it's so expensive that nobody's going to want to use that. So I've always toyed with the idea of doing a CoQ10 addition to the vitamin IV, and that would be beneficial for the heart, but I'm not sure the cost, makes sense. It's literally hundreds of dollars just for the CoQ10. Another crazy thing, in years past, we used to be able to buy the individual vitamins at a relatively decent price and add them to the IVs. During COVID, when all the manufacturers shut down and there weren't millions of bottles of these things available, all of a sudden the prices started to go crazy. 5, 7, 10 times the cost. And we've resisted, of course, raising prices because I'd rather have people do the procedure than not. And it's odd that other companies are popping up where they do cryotherapy and they walk in, get you to freeze yourself for a few minutes and get in and out of the chamber. And they're doing IVs that cost $400 or $500 for vitamin IVs, which should never be that cost. So you can take a look at our cost and what we charge compared to what these other companies are doing. It's a world of difference. We've never really raised our fees. So I don't think it warrants raising the fees up like that.
Okay, we got this one from Reddit. 33-year-old female interested in stem cell for neck disc bulging. She said that some professionals she went to say they're pressing the nerve and some don't, and have a pain, different issue, tendonitis, scalar bursitis. Advice on would this help stem cell?
Well, yeah, stem is great to help to repair damaged or inflamed tissue. So my first comment would be to get an MRI of the neck and, cervical MRI. If it's a scapular bursitis or something with her shoulder, get an MRI there as well. And if it's a tendonitis, is that in her arm or leg or where? I would need to know where and just see an MRI of these areas so we can see exactly the amount of wear and tear and where it is. So if you have a biceps tendon tear in your shoulder, that's sort of in the front as you rotate your arm laterally, I can press on it and pinpoint it, and we know exactly where to inject. If it's supraspinatus, it's a little bit off to the side of the shoulder, subscapularis, and then the posterior aspect we could inject. So it depends upon what the MRI shows. That's always the best way to look at any joint. We do that for knees all the time, hips, shoulders, neck, back. So that gives us the perfect wrist, elbow, gives us the perfect picture of the joint and where the damage is. So yeah, your own cells are great to be able to create healing and repair. Phone lines are open if you'd like to call, 888-420-9272, 888-420-9272, and we'll get you up on the air.
Got some people asking, should I bank my child's cord blood for its stem cells?
It makes sense for that child because, God forbid, something happens over the course of that child's young life. You could use those cells. So, yes, you should.
Okay. Got a caller.
Hi there. How are you?
Good. How are you?
Great. How can I help you?
So, long story short, I'm 29 years old, and about 6 or 7 years ago, going on to 7 years ago, I suddenly lost my sibling in a motorcycle accident. Since then, I've been experiencing PTSD. I have more of the emotional part down pat, but I do experience PTSD. And I did see a video on YouTube that you did help a patient with PTSD, but his seems to be more of a physical PTSD. So I'm wondering if stem cell therapy can assist with something like that.
So yeah, we have to look at the mechanism. So PTSD, whether it's from a physical injury, damaging brain cells and damaging neurotransmitters, that creates the difficulty or the defect. In a similar circumstance, without that physical injury, your cells and your neurotransmitters are physical entities. They're physical things. So because of that huge stress on your brain and your cells, you have a difficulty with processing things. So your neurotransmitters may be a decreased number. Your cells have been shocked from that stressful mechanism to help to calm your brain down or calm your body down. So I think they're both physical entities. One is much more of an injury with a direct injury or hitting the head or damage to the tissue. And another probably has similar damage but without that injury. So we can't say that both are not involved in a physical component. So I think the physical component's there. It just wasn't a hit or an injury that could create that. And with the majority of people that we've done stem cell therapy on, even just intravenously for diabetes, for liver, kidney, heart issues, lung, etc., they always seem to have improved memory, focus, concentration, mood, because they're making new neurotransmitters, because you're getting some of that intravenous going to the brain. So brain-related issues, we of course do the nasal droplet where we put that into the brain. But I think that's where you get brand new brain cells, because stem cells become brand new brain cells, and therefore you have all your neurotransmitters coming back based upon the repetition of delivering and differentiating it to brand new brain cells. So I think that would be an idea that makes a great deal of sense.
Very cool. Thank you so much.
Great. Thank you for your call. If we could help you out, certainly give us a call. We'd love to help you.
Will do. Thank you.
Okay. Bye-bye now. Phone number here, 888-420-9272 if you'd like to call in to ask a question. 1-888-420-9272. The website for the office, we'd love you to take a look at the website. It's drcalapai.com, drcalapai.com. And you could go to the website, email, as many people have done to the website, so we can take your calls and try to get back to you as soon as possible. Myself, Donna, my office manager, Mindy, will answer your email as soon as we can. But remember, if you're sending in a 2 or 3 page email, we can't understand that entire mechanism and give you a pure answer as to what you should or shouldn't do, because, of course, we have to do that with a visit, your consult, and take your history, examine you, look at your testing. So for a lot of the people, simple questions and answers can go back and forth on the email. It's just we can't go through, your whole visit doing that. That being said, for a lot of people who don't live near the office, we do telehealth visits. And you can call the office and set that up, 516-794-0404.
So we have this question on your thoughts for STEM for ADHD. Have you ever come across that?
In a similar mechanism, because we've done it for patients that have autism, that have a variety of brain-related disorders, it would be nice to get some sort of feedback from either physicians that have treated the ADHD and can impart some correlation with that. We've had people where meds don't work. And where meds don't work, invariably, your best mechanism is for your body to repair itself. So I think it would tend to make sense. I don't know how many patients we've treated that have had ADHD and other things. I'd have to try to figure out how to research that, because if a person's got memory loss or dementia or Alzheimer's and ADHD, and we put in, dementia or Parkinson's or pulmonary fibrosis or COPD, it's not as though we may have been treated directly for ADHD, but I know there are people that have it. I just have to figure out how to get through the charts to see how many people have had ADHD as a secondary mechanism, so we can see how many people have had benefit from it. But I think it stands to reason that, putting brand new cells in and repairing your body makes all the sense in the world.
Got one on dry eye, asking stem cells on dry eye. Does that help?
Well, it can. Dry eye in some cases is caused by Sjogren's syndrome, which is an autoimmune disorder. And we have some interesting articles that I'm going to talk about for autoimmune disorder and stem cells with rheumatoid. So stem helps to shut down the inflammatory cascade of autoimmune disorders. So that's a great benefit. Patients with Sjogren's, dry eye, dry mouth, you can do their blood test. Usually you see a positive ANA, which is a generalized autoimmune marker. And then a secondary blood test we'll do looking at Sjogren's antibodies, SSA, SSB, lupus, and some of the other, thyroid autoimmune concerns, and see whether or not see whether a person has those second antibodies that point towards that. So with those individuals, typically, they'll get benefit because you're shutting down the inflammatory cascade of the autoimmune disorder. But I'd like to be able to see a note from an eye doctor, ophthalmologist, as to what he thinks the hidden cause or the cause of the dry eye might be. So yeah, the more information we gather, the better.
Okay, we got another Instagrammer. My 33-year-old daughter is on the autism spectrum, high functioning, but she is terrified of blood work. Do you have any suggestions?
Terrified of blood work. There may be labs that can do testing from a finger stick for certain blood tests. Not every blood test is available for that. So there may be labs that can get some tests done through a droplet of blood with your finger stick. We've had patients that have difficulty drawing blood before, of course, and some of those individuals will just have them lay down in the room and, use tiniest needles, butterflies to draw the blood. And most people haven't had an issue with that. Even, kids and teenagers that want to do that. She's 33, but I understand her trepidation for having blood work done. I'm trying to figure out how, in any other way, we could make that easier for her. Some patients will take a Benadryl before they come to the office. It'll make them tired and sleepy, and then we can get the blood drawn. Of course, they have to lay there for a little while in one of our side rooms, to wake up and such. And there are some people that do STEM that want to take an anti-anxiety medication that they've used just to kind of calm them down before they come to get the STEM done. So there are different ways to do it. Of course, with those individuals of all ages with spectrum issues, you want to look at heavy metals because I think plays a major role. We've seen that. And for those people that typically have a lot of heavy metals on board, you want to pull those things out of your system. They also typically don't methylate well, so we may want to use the B12, correct vitamins and minerals. They also seem to have more allergies than the average individual. So I would work that patient up as thoroughly as we possibly could. And we have done STEM for autism spectrum disorders.
Got some questions on, people that are paralyzed that have injuries to their spine. Is there any way that stem cells can help those?
There is some information on stem cells working for paralysis, and it goes back over a variety of years. In many cases, doing the stem as soon as possible would tend to be a better idea. I haven't seen or treated a paralysis patient with the mechanism that we use, but I think that doing stem with a nasal approach is better than using the epidural, which had been used before for paralysis. I'll have to look online and look to gather a whole bunch of studies on paralysis and stem cell therapy to see what the outcome has been. I can't comment on that exclusively because I haven't treated patients with paralysis with stem yet. But I'll do a little research on that, and we'll kind of bring that up on our next program.
We have this one. I'm 38. I've had 5 knee surgeries, 4 on the left, 2 on the right. My x-rays look like someone snapped a PVC pipe and decided to use it for my knee joint. I'm 6'2" and 250, so I played sports my entire life, and the Army didn't help anything either. I've been struggling with OA since my mid-20s. I just saw my ortho for a partially torn meniscus. He doesn't see anything that he can do surgically that will help my pain and swelling, so he prescribed PT, and we did a steroid injection to help me out while I start PT. After that, we're going to do PRP injections and stem cell, but I'm apprehensive.
I think stem cell is the best mechanism for repair, and we have lots of patients that have bad knees and some that don't want to have any surgery at all. Some that agreed to do the arthroscopy where they cut away some of that tissue, but then the arthroscopy patients tend to need more surgery down the road because you're cutting away that cushion between your bones. So typically your best option would be stem if your knee is that bad. And part of the problem is, without doing an MRI, you can't see everything. So if you're looking at an x-ray, you're only seeing the outline of the bone. I'd much rather, and right off the bat, if you were to see me, I would do the MRI. get that done, see what we have, and do that as opposed to either other surgical procedures. PRP is good, but it's really meant for mild issues. It's not going to grow and repair like STEM does. It's a world of difference. So if it's a very mild issue, we might start with the PRP. Also, when we do STEM from bone marrow, we're getting PRP with that. It's automatically there. So we get that with our procedure as we, spin and then inject that back into the system. So first step would be MRIs, and I would go directly to STEM. Because STEM also shuts down the inflammatory cascade. Other doctors don't necessarily, think about that.
Got it. And then we have this one. There it is. Does stem cell therapy help with MS, and if so, how?
So MS, Parkinson's, Alzheimer's, stroke, we can see articles of that and videos on the website. Stem cell therapy shuts down inflammation, but it also makes brand new cells. So if the sheath of the brain, the myelin sheath, is being damaged, which in many cases we think is created by heavy metals and maybe some sort of viral mechanism, stem cell therapy shuts down inflammation and becomes new brain cells. So much so that you can see MS patients who aren't able to move or function different parts of their body, they regain their function back. There's a great video, 2 videos, one on Parkinson's, one on MS, where after a month of doing stem cell intravenous and a nasal droplet, those individuals got out of a wheelchair and they explain what happened, day to day, week to week from that procedure. There's a lot of research on stem cell therapy for neurologic disorders, including Parkinson's and MS. We did a couple of weeks ago a discussion of Parkinson's, where the brain's not making the dopamine and putting the stem cells in makes new cells in the substantia nigra. They become new cells of the substantia nigra that make dopamine, and that's the only way that those patients could get improvement. Similar for the MS patients. So the literature and the research has been there for a long time. We had one patient who went down to Mexico to find out about stem cells because they thought that was the place to go, but they're only using umbilical or amniotic cells, and they wanted to charge the woman $60,000. And I said, I've heard $30,000 from Mexico, Panama, Costa Rica. Why would they charge so much? They wanted to give her chemo before they gave her the stem cells. I said, doesn't make any sense. Why would you put chemo into a body that's already damaged and then try to create repair with the stem? It makes no sense at all. There's no reason for that. So, it makes no sense to me. But yeah, stem cell therapy, we treated MS successfully with stem cell therapy. People regain benefit, function. As I say, you can take a look at the videos on the website. 1-888-420-9272. If you'd like to call in to ask a question, you could do so now. We have a patient that's got chronic headaches, an emailer to our website. So chronic headaches occur as a result of a few things. Most often headaches are caused by either muscle issues or spasm in the neck or pressure on the nerve roots coming out of your spine, especially the first 2 bones, the atlas and the axis that are on your cervical spine, and pressure on the nerves that go to your head will give you the headache. For some people, if we evaluate that through a physical exam, we may recommend that they just go get some massage or some gentle physical therapy. For some people, we'll send them to an osteopathic physician like Dr. Simone, who's in Babylon and Bayshore, and we'll do some soft tissue work, maybe some craniosacral therapy. And that can help to change the mechanism. For people who've had ligament wear and tear in their neck based upon MRI, for some people we've done prolotherapy, where we inject nutrients into the area. Other people we've done PRP, and yet others we've done STEM, depending upon the severity of the issue. Headaches can be caused by a food allergy, so we'll test for foods, get those out of the picture. Headaches can be caused by magnesium-potassium deficiency, so we would look at all the underlying causes and correct each one.
A follow-up on that in the Instagram chat. Isn't a headache a sign of dehydration?
To some extent. Not everybody who's dehydrated has a headache, so we've seen lots of people who get dehydrated. For some people, you grab the skin and you pick up and see if the skin is tenting. It's called tissue tenting, and if it stays up, that means they're dehydrated. And drinking a good amount of water for some people will help with headache. That's probably a small percentage of people. I think the largest percentage we see is based upon issues in the neck and positioning. Some people use too many pillows when they go to bed at night and their neck is cranked way out of normal position and they wake up with a headache and they've got to kind of work their way back out of that. But it depends upon, the diagnostic cause. And doing the blood test that I do, the big blood test, we're looking for dehydration. If we see it, of course, then we act upon it the moment that the blood test is reviewed. We've got a big device in our office, filtrated water, and it's got oxygenated water, and we'll get people to drink a good amount of water. And constantly, people need to at least drink 6 to 8 glasses of water a day, some more, depending upon activity.
And then we have this question on Reddit. Do you have any experience using stem cells to repair aortic valves?
I don't. There is some literature in, I don't know if it's Johns Hopkins or Harvard, one of the facilities, because they've done tons of research on stem, where they were taking catheters and placing stem cells into heart muscle where a person had a heart attack, and they had significant repair of that heart muscle. Because the valve is not vascular, you can't get blood flow there. I don't know of any study where they catheterized and went in to inject stem to a valve. I'm not sure how well that would work. That being said, when you have a tear in your knee in the meniscus or a ligament there, which is similar tissue to a valve, it'll absorb to a damaged area and make brand new cells in that area. I'll have to look at literature on that because I think it would be hard to get it to that spot. That being said, for people that have heart failure, we've done stem cell IV therapy, and the stem cell IV will get to the heart muscle because it's very vascular and make brand new cells. So now you have more and more heart muscle cells and the contraction becomes stronger. And you can see that on a echocardiogram because you have an increased ejection fraction. So a person's got a 20, 30 ejection fraction means the heart is not really strong. And you do the stem and 3, 4, 6 months later, you've got a 40 or 50 or 60% ejection fraction. And that's the only thing that was done. It's pretty spectacular. Wow. And the same could hold true for lungs and, kidneys and other organs.
Okay, we got this one from YouTube. Is it possible to consume too much vitamin C? Are there risks?
Well, too much of anything could be a problem. Even too much water could be problematic. But the vitamin C, you want to have somewhere between 4 to 6 grams a day because there's some really good research that shows vitamin C quadruples your killer cells. And when we do blood testing on people, and again, this is the whole most important sentinel point of vitamins. When we do your blood test, if you're low in vitamins, we then make steps to correct those vitamins and then retest that blood that shows you're deficient a month later to prove that what we did put you into the perfect zone. So if your C is low, we give you 3, 4, 5,000 a day, and we get your levels back and you're in the right range, great. If you decide to come in and you're taking 20 grams a day, or 20,000 milligrams a day, which would be a lot, and your levels are way too high, we'd back you down because we want you to be in a great range. Same thing for vitamin D. B vitamins are water-soluble, so, they're more easily used up by your system, but you can't go crazy with D, but you want your D to be roughly 80 to 100 on your blood test. So that's why we track and correct vitamins so people never get to take too much. That being said, we also do vitamin C IVs, and the vitamin C in the IV can go up to 50,000 milligrams, which can get to your entire body, and all your cells typically would suck it up. And we've had people do that for years, and other doctors have done that for better part of probably 60, 70, 80 years without side effect or risk. So it depends upon what we're trying to do. Orally, vitamin C, most people, if you go past 7 or 8 grams, they'll get loose bowel movement, and then people might stop. And there are some people who like to take vitamin C to bowel tolerance where they have a cold or an infection. They take a lot of vitamin C, take some every hour until they have a loose bowel movement, and then back it down. So there are a lot of different ways that people do it. But I like to have the blood test tell us exactly where you are.
Looking. Last call.
Okay. 888-420-9272. If you'd like to call in, do so now. 888-420-9272. 9272. Have a email from a patient who has fatigue. I mean, we see this every day. There are probably 50 causes of fatigue. So when we talk about it, we ask about the history, the type of fatigue, when did it start, where were they? Did their kids go to school and now the kids in class were sick and the child brought it home to the parent, and it may be Epstein-Barr or any bug for that matter. We try to be the detective to look at all the underlying mechanism. Then the blood test tells us everything. So viruses can do it. Low vitamins can do it. Low thyroid, of course, can do it. Low testosterone, low DHEA, low IGF-1 hormone. So many different things. As I say, different viruses too. Cytomegalovirus is very common. COVID and some of the other bugs are common. So it depends upon a variety of things. And that's why we look at so many different things. And once you find it and you work on those causes, plural, you get your best result.
And then I have this question, Reddit, on emphysema. Do you know anyone who works on emphysema patients for cell therapy?
Absolutely. We've done that many times. Emphysema or COPD is damage or degeneration to the lungs, sometimes from a history of smoking. Other times people have it, they never smoked. It could be from heavy metal exposure, chemical exposure. So the beauty of STEM, and you can think about this for any degenerative disorder you have, once we take your stem cells from your body, it takes a minute and a half to extract, spin, we'll put them intravenous, and then we'll do a nebulizer for emphysema or COPD or even pulmonary fibrosis, where in that chamber you're holding and breathing that mist, stem cells are in that chamber. We don't put a drug in there. So you do the stem cell IV, then you hold the nebulizer, and you're breathing stem cells to your lungs. So it's a double approach, IV and nebulizer, to your lungs. And there are great videos on the website for that. A lovely lady who had difficulty going down the block to go shopping. And within a week or so after doing the stem, she would take her little cart and go shopping and go back and had no problem doing that. Within 3 weeks, she went to her grandchild's soccer game or sporting event. She parked her car up on a hill where everybody parked their cars, walked down the hill, watched the game, walked back up the hill with her daughter because she went to see the grandchild's game and had no difficulty. And she does a great interview on the website. A gentleman who had COPD, the same day that we did the stem, when he walked out of the office, he said, I just feel like I feel better. I feel less anxious. I think I'm breathing better. And he didn't use his inhaler because he was using it 2 or 3 times a day. And based upon the stem, he didn't use his inhaler since. So he's had a pretty dramatic and pretty quick result. So stem is by far the best for COPD, emphysema, and pulmonary fibrosis.
Got an interesting one here. Could consuming cow's milk actually impact hormone levels? And is it safe for someone with concerns about hormone-sensitive conditions or yeast overgrowth, like candida?
Cow's milk is not going to change your hormone production or function. There are people who have allergy to cow's milk. It's very common. We see that all the time. And we tell them to switch to either almond, maybe soy, unless they're allergic to soy, cashew milk, yogurt, etc. So we switch them away from cow's milk. Humans are the only creatures that use another animal's milk for nutrition, which is a corny thing to say, but it's true. So for so many people, they do better with different sources. There is sugar in cow's milk, so if you want to get away from the sugar, you can get away from the cow's milk. So between the allergy, the sugar effect, it's not going to change your male or female hormones. And there was another part of the question?
The other part is it safe for someone with concerns about hormone-sensitive conditions or yeast overgrowth like candida?
Yeah, the yeast overgrowth issue is extremely common because the Western diet has always been full of sugar, 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 not just table sugar, grains, fruit, bread, pasta, oatmeal, etc. So for years I've been saying this, better part of 38 years, keep the sugars and carbs down and your body will do better. Bloating goes away. We can skin test for the candida group of organisms, and then once you cut the carbs down, and there are nutrients to use against it, which we would use, you get a far better result. Bloating goes away, headaches go away, rashes on the skin that occur with that syndrome can go away. So if you're drinking a glass of milk, it's 8 grams of sugar. So that's a decent amount of sugar. You try to knock that down so that you're not constantly putting so much sugar on board. but the same with most fruit. We tell people to have berries instead of the other fruits. Cashew milk yogurt's great. It's made from cashew. You can put some berries in there and maybe even a protein powder in there and make yourself a smoothie. It's terrific and very healthy for you, plant-based protein. So there are different ways to get good things into your system that taste good without getting all the sugar. So we deal with this, sugar and the yeast and candida issue and allergy all the time. So there are ways to get around that.
Last call.
All righty.
888.
888-420-9272. If you'd like to call in, do so now. We have a few moments left before I have to go back and take my dogs out for a run or a walk. Or they're going to run and I'm going to run. They'll drag me down the beach.
We need them in studio, so.
Yeah, we'll have to do that. I just got to figure out how to do that because Delilah is she's so happy and jumpy and rambunctious. She's like Tigger, from Winnie the Pooh. She's just jumping around. And the latest thing she does, which is adorable, and in the morning and I feed him and let him out and run around and stuff, and she'll come back in and she'll just look at me. Then she'll just, I don't know what the best word I guess is, lunge at me because she wants to grab me. She'll put her hands on my shoulders and just put her face in my face, and it's like giving me a kiss and stuff. But she likes looking at me in the face, so I've got to hold this massive dog up, and so she can get her little hug and her kiss in. And Zeus is chill. He's like the cool dude. He doesn't jump around too much, but when they want your attention, they'll bowl you down. Zeus is 125 pounds. He's a big German Shepherd, so when he wants to come and just push up into me, it's strong. It's a lot of weight. And you got two of them. She's got to be 150 pounds by now. That's a lot of weight. One pushing you one way, one the other. And sometimes they roll around on each other. It's like this ball of dog rolling around. And it's brown and white and dark brown and black. And, and then thud. They just are all over the place. So it's a lot of fun. I enjoy when it snows out because I let them sit out on the deck and they just roll around in the snow. And gives me like a half hour, 45 minutes apiece. So I can let them do their thing. But yeah, we definitely have to bring him in. I just got to figure out how to control her. He'll just sit there and watch me and he'll be cool. But she's still a little bit excitable. Okay, friends, thank you so much for listening to and watching the program. Give us a call. We'd love to help you out. Office number is 516-794-0404. The website is drcalapai.com, drcalapai.com. You could email me through there, as you probably already know. We'll be back here again.
Subscribe.
Yes.
To YouTube.
Please like and subscribe. Send our videos and things, however you're supposed to do that, to your friends and your family. Tell them about us. We'd love to hear from them, expand our audience. We've gotten some crazy results, and now we're over 100 some odd thousand.
Crazy.
Likes, reviews. Yeah, we're going crazy with this, which is fun. So I like this much better than radio, by the way.
Me too.
So radio is fun. 35 years, good enough. It's also more connective this way, because people ask questions and et cetera. Radio is just at that moment, and then, patients will come in, of course. But I like the fact that when I get on my phone and look at what's happened from the show today, and there could be a ton of questions and comments and things, it's really interactive, which is what I've always been about. The interaction between patients, whether it's for a few minutes on the phone, or in the office, is really, for me, what it's all about.
I have the people in Instagram asking, what's the YouTube name? And it is just Dr. Chris Calapai. Easy.
Yep. Didn't want to make it too difficult, although my last name is not the easiest to spell. Calapai. Dr. Chris Calapai. Good stuff. Thanks to Frankie and the crew here. God bless you all. We'll see you live on Friday and Saturday. Bye-bye now.